Assalamu alaikum. I am Dr. Umer Salim, consultant pulmonologist. As we had discussed in the introduction video that we will discuss the past papers of FCPS and MCPS Pulmonology. So today we are discussing April 2015 FCPS paper as my student asked me to solve this paper first. So we will start with the question number 1. Question number 1 starts with: a 35 years of aged female presented with ill health and right-sided chest pain, bloated face and pallor look with rash all over the face. She was diagnosed as tuberculosis pleural effusion, which was exudative and lymphocytic. She was on anti-TB drugs for 2 months, but no response. On examination, she has also alopecia. The A part of the question is, what is the diagnosis? B part is, write 3 steps to confirm the diagnosis. And part C is, write 4 steps in the management. So, as you can see, this is young female, and young female with bloated face, pallor look and rash all over the face is giving a clue towards the autoimmune disorder. As also the pleural effusion is exudative and lymphocytic, which is very common in autoimmune disorders. Because the patient has not responded to anti-TB drugs, so we will think of other diagnosis that patient has anything else which is not responding with the treatment of anti-TB drugs. So our first differential diagnosis which comes in my mind is systemic lupus erythematosus, because all the clinical features are fitting in this diagnosis, like young female, bloated face, pleural effusion which is exudative lymphocytic, pallor look and rash all over the face. So my diagnosis will be systemic lupus erythematosus, and the B part will be, write 3 steps to confirm the diagnosis. So we will ask the diagnostic test for systemic lupus erythematosus like ANA, anti-DS-DNA, anti-SM antibodies, complement levels, urine analysis, pleural fluid for lupus cells, pleural and renal biopsy. The part C will be, admit the patient in the ward, stop anti-TB drugs because it is of no use as the patient has no response with the anti-TB drugs, and avoid sunlight, use sunscreen, and start systemic steroids, liaise with rheumatology for anti-systemic lupus erythematosus drugs like methotrexate and azathioprine. So this was the solution of question number 1, FCPS April 2015 Pulmonology paper. If you want another paper to be solved, just let us know in the comment box. And in this was the question 1, and we will be solving the series of questions, the series of question paper in our series of videos. Thank you. For more solved cases, get this book in nominal price from local medical bookshop or online nationally and internationally from links below.